Hello guys. Medyo okay na siguro yan. Medyo late ata ang dating. Okay, yes. Good afternoon. We're going to discuss. By the way, welcome to my first live stream lecture. My YouTube channel is Teacher Nurse. We're going to discuss we're going to discuss today about isolation precaution and hand washing. Okay, we're going to start now. Okay, isolation precaution. Ano nga ba yung isolation precaution? Pag sinabi mo, madami kasi nagtatanong ngayon sa panahon ngayon, ano nga ba yung isolation precaution? We're going to discuss what is the isolation precaution. And the second topic is the hand washing, the proper hand washing. Okay, we're going to start for the isolation precaution first. Okay. What is the isolation precaution? What is the definition? The definition of the isolation precaution is a special precautionary measure, practice, and procedure used in care of patient with contagious or communicable disease or diseases by the wearing of non-porous articles such as the gloves, gown, goggles, and face masks. That is the definition of isolation precaution. Next one, what is the learning objective of isolation precaution? By discussing of this topic, we have objective of this learning. What is the objective of isolation precaution? Number one, to explain the rationale of isolation precaution. Ano daw ibig sabihin to explain the rationale of isolation precaution? Ibig sabihin niyan ay para malaman natin kung ano ba ang ibig sabihin ng isolation precaution at ano ba paano ba natin gagawin yung isolation precaution para maintindihan natin. Kaya dito sa one of the learning objective of my discussion is to explain the rationale for the isolation precaution. Number two is the outline the types of indication of isolation precaution. What is the types of the outline of indication of isolation precaution? We will going to discuss about this. This is the only, I will give you the objective of this topic. Number three is the list, the type of personal protective equipment used in isolation precaution. Ito yung mga nasa list kung ano mga dapat gamitin natin, yung mga PPE na tinatawag natin o yung personal protective equipment. Yan, kung mag-a-attend tayo ng patient with na naka-isolate, ano mga yung dapat natin gamitin. Okay, this is the learning objective. Next one, what is the key point? The key point is number one is the microorganism can be spread from patient to staff. Yun. Nag-i-spread daw yung microorganism hindi lamang sa pasyente lang. hindi umiikot lang yung microorganism sa patient lang. Kapag halimbawa ay meron ng isang pasyente, hindi maaaring hindi sa kanila. Kasi nga, pag naka-isolate ang patient, pwedeng ma-contaminate or pwedeng makahawa siya from patient to patient. Pwede rin naman ng patient from the staff or staff from the patient. It's depende yun sa sa mga situation. And then the second key point of this lecture is the isolation precaution can reduce transmission, decreasing or decreasing the spread of microbes. Yan. Paano paano natin ma-spread, paano natin marireduce yung transmission ng mga microorganism. Nadi-discuss din po natin doon. And then the third one is the component and the hygiene. What is the component? The number one is hygiene, personal protective equipment, single room, the ventilation. The most important is the ventilation and the restriction of the movement. Yan. Madi-discuss po natin yun po yung mga key point na i-discuss natin mamaya pagdating po doon sa isolation precaution. Pinakikita ko lang muna po sa inyo yung key point niya at saka yung mga components. Last po ng key points niya is yung must be applied according to the sign and symptoms. Yan. Ang example naman po niyan, for example naman po, kapag yung depende po sa sign and symptoms ng pasyente, kinakailangan naman po natin na depende ang pag-isolate, depende po sa case ng pasyente or depende po sa sign and symptoms ng pasyente. Meron naman po kasi minsan ng iba ay pinagsasama-sama na sa rin, even it's ang pasyente ay communicable, hindi naman natin alam na ang pathogens niya ay magkakaiba. Kaya pwede pa rin maghalo-halo o magsama-sama yung infection niya, magkakaiba talaga. Dapat kung mag-a-apply kayo ng mga isolation room, make it sure naman po na ang pathogen ng microorganism ay pare-pareho. Para at yun nga, ang sabi dito, you can apply it's depend to the sign and symptoms of the patient. Next, chain of infection. If you can say the chain of infection, number one is the infection result from an interaction between an infectious agent and the susceptible host. And the second chain of infection is the interaction occurs by means of contact between the agent and the host is affected by the environment. And the third chain of infection is breaking the chain of infection by interrupting transmission is generally the best way to prevent infection. Okay, this is the chain of infection, the three chain of infection. Okay, we're going to discuss also the transmission infection. If you can say that transmission infection, you have a contact spread. Pag sinabi natin pong contact spread, meron po tayong tinatawag na direct contact, indirect contact, at saka po yung droplet. Ang droplet po is under na rin po siya ng contact. Kaya po pag sinabi naman po natin, unahin muna po natin yung direct contact. Pag sinabi po natin direct contact is from one person to another person. Ibig sabihin po niyan, nahawa ka sa pamamagitan ng ibang tao. Yun po yung tinatawag natin direct contact. And then, pag sinabi naman po natin indirect contact, iyan po ay contaminated equipment of the surfaces. For example naman po ng indirect contact, for example po ay yung pasyente po, humawak siya sa mga doorknob, gumawak siya ng mga anything na nahawakan niya, tapos hinawakan ng ibang tao, ayun po ang tinatawag natin indirect contact. Yung hindi mismo yung sa ibang bagay po nang nakuha natin yung infection. Number 3 naman po is yung droplet. Pag sinabi naman po natin droplet, expelled when sneezing or coughing less than 2 meters from the source. Pag sinabi naman po natin droplet is from the respiratory system. Yan. Pag sinabi pong droplet, if nanggaling po minsan yan sa sneezing, bahing, pag-hatching, pagsinga, or pag-ubo, yan po lahat po yan galing sa respiratory system. Kaya po, katulad nga po ngayon ng COVID-19, nagkakaroon sila ng social distancing ng 2 meters. Kasi nga po, droplet po ang COVID-19. Kaya ah, pinapatupad nila yung less than 2 meter na social distancing. Tapos, pag sinabi pa rin natin yan, yung droplet, nakukuha din natin yung droplet, yung nakukuha pa rin natin yan. Kaya yung kinakailangan natin is yung maglalagay ng mga mask. Yan, one is the most important is like wearing of mask. Lalo na kapag droplet ang pinag-usapan natin. Hi, Edsel Hart. Uh, ka-GC mo po ba si Jessica Kumba at tunay na buhay? Yes po, ka-GC ko po siya. Welcome to my live, Edsel Hart. Thank you po sa thumbs up. Okay, we're going to continue our discussion. Okay, the transmission infection. Okay, transmission infection number 2 is kanina po na-discuss po natin yung contact. Ano po yung contact? Tapos sumunod po is yung airborne spread. Kanina po yung isa po ay contact, tapos yung droplet, tapos yung airborne spread naman po ngayon. Pag sinabi natin kung airborne, small particles can remain airborne. If you can, from the word airborne, ito po ay sa hangin. And then transferred more than 2 meters from the source. Ayan po ay natatransfer ang infection o natatransfer po yung virus within 2 meters from the source of the infection. And the third one is vehicle spread. And the third one is the vector borne. Okay. Next, we have the principle of isolation. What is the principle of isolation? We have the four principle of isolation. Number 1 is understand what is achieved through the isolation. Number 2 is know the route of transmission of infection agent. Supposed to be you should know what is the route of transmission of infection. Bakit? Kasi nga po, hindi niyo po alam paano po ninyo maiiwasan ang paano niyo po maiiwasan yung isang sakit kung hindi niyo po alam kung paano po or ano po ang dahilan kung paano po siya nahahawa ang isang tao. Kaya you should know the route of transmission of infection agent. Okay, number 3 is the reduce of risk. Paano po natin mapapababa yung infection? And then the fourth one is the emphasize the use of protective barrier. Yan, kinakailangan po natin kung paano po natin malalaman kung paano po natin gagamitin yung mga PPE, yung personal protective equipment. Tulad ng gloves, mask, goggles, gown, yan po yung mga personal protective equipment. You should know how to use that one. And then the third one, we have the isolation precaution. Pag sinabi po natin isolation precaution, we have the standard precaution and the transmission base of precaution. Okay, we're going to discuss one by one. The first one is the standard precaution. What is the second one is the transmission based precaution. Okay, we're going to proceed to the standard precaution. Pag sinabi po natin standard precaution, basic precaution recommended for all the patient. Also called as routine practices. Yung pang-araw-araw po natin ginagawa, yan po yung basic precaution. Then second one is based in the fact that unsuspected agent may be present in the body fluid, non-intact skin, and mucous membrane of all the patient. Next one, we have the standard. What is the standard precaution is the hand hygiene. The most important is hand hygiene. Number 2 is disposable. Pag sinabi nga pala natin hand hygiene, may ginagamitan tayo ng hand washing by using soap and water. And then pag sinabi natin hand sanitizer, by using of the sanitizer. And then the second one is disposable gloves on contact with secretion, excretion, or body fluid. Yan. Paggamit po ng gloves, yan, kinakailangan po talagang gumamit ng gloves, lalo na kapag yung hawak tayo ng mga secretion na nanggaling sa infected person. Yung mga nailabas ng pasyente, ihi, dumi, yan. Yan po yung mga secretion, yung phlegma, secretion po yan from the patient. And then sa another standard precaution, protective apron or gown for body contact with patient or patient bed. Yan, protective equipment natin, gumagamit po tayo ng apron. Yan, para contact sa pasyente. Kinakailangan natin ng mask, apron, gloves, yan po. Once na magko-contact po tayo sa pasyente natin, yan po ang gagamitin natin. And then the next one is appropriate handling of equipment and linen. Yan, paggagamit naman po pag maglilinis naman po tayo tulad ng mga linen o yung mga equipment na ginamit ng pasyenteng infected, kinakailangan po din natin ng gloves. At saka make it sure na nasa tama po yung paglalagay ng mga dirty linen natin. Kasi nga po, ginamit siya ng mga infectious patient. And then the next one is the environmental cleaning and spills management. Then no cup, mask, or shoe cover. Yan. Paglilinis po ng mga environment, lalo na po yung mga nasa room ng pasyente, yung mga gamit po na kailangan po i-proper cleaning. And then you cannot allow to enter to the patient room without using a cup, mask, and shoe cover. Lalo na po kapag ang pasyente ay isolation precaution. Make it sure before you enter the room by wearing a cup, mask, and shoe cover. Next one, the structural element. Pag sinabi natin structural element, yan yung una is hand washing. Yung hand washing, yan, makikita niyo yung picture for the hand washing. Yun sa structural elements natin, meron siya ditong hand washing. The second picture is hand sanitizer. The third picture is by using of the PPE. And the fourth one is social distancing by using inside the room of the patient. Okay, next. Additional transmission-based precaution. Pag sinabi natin additional transmission-based precaution, yun nga po yung na-discuss ko na rin po kanina, yung contact precaution. And the second one is the droplet precaution. The third one is the airborne precaution and the protective isolation precaution. Na-discuss na po natin yung kanina. Ano sa pag-contact precaution? Pag sinabi natin contact precaution, we have two types, indirect contact. Pag sinabi po natin direct contact, ano po yung direct contact? Direct contact is from person to another person. Pag sinabi naman po natin ng indirect contact, is ayun po ay sa galing sa saan po? At sinabi po natin indirect contact, hindi po nanggaling sa isang tao, kundi po sa mga bagay na nahawakan ng ibang tao. Yun po yung indirect contact. Kasi yung droplet, from the respiratory infection, like yung coughing, yan po yung mga example of ng droplet. Airborne isolation, also we discussed already, and then the protective isolation, done already. Next, contact precaution. Pag sinabi po natin isa sa mga contact precaution, ito yung personal protective equipment. When likely to be in contact with environment contaminated with agents such as DRE, MRSA, or the Clostridium difficile. Okay, the second one is the single room or room with another patient infected with the same pathogen. Ito po yung sinasabi ko kanina na kapag po halimbawa ay naka-admitted or kapag halimbawa po admitted po yung patient at naka-isolation precaution, make it sure naman po na ang bawat room na na-isolated room ay hindi po natin masisigurado na isa lang sa isang room. Minsan po sharing. Make it sure naman po na ang ang room po na yon, sa isang room na yon ay iisa po yung tinatawag nating pathogen or iisa yung sakit or yung precautionary, yung isolation precautionary natin ay iisa. Halimbawa ay airborne. Okay, lahat ng room airborne po. The second one, lahat ng room is contact. Lahat ng room is droplets. Ganun po ang dapat kinakailangan kasi single room or room with another patient infected by the same pathogen. Hindi po yung sama-sama magkakaiba yung precautionary measure. Okay, now next is the clean gloves when entering the room. Okay. Pag sinabi po natin na yan, kinakailangan po natin na once na mag-enter po tayo ng room, ang pasyente na meron pong signboard na nakalagay ay precautionary measure o yung tinatawag natin minsan na nakalagay sa may pinto is contact precaution, airborne precaution, droplet precaution. Yan po, kinakailangan po natin gumamit talaga ng gloves. Okay, next one is clean gown, apron. It's substantial contact with the patient or environmental anticipated. Yan, ginagamitan po natin yung talaga ng mga apron, gown, tsaka yung mga PPE natin before enter the patient room. Next one, protective isolation. Pag sinabi natin protective isolation, yan, recommended only for allogeneic hematopoietic stem cell transplant patient. Then second one, positive room air pressure relative to corridors along with the HEPA filtration incoming air and air changes per hour. And then appropriate engineering controls. Then consider po natin yung single room na sinabi with negative pressure and the positive pressure very difficult to maintain. And then rooms with anti-rooms have less air movement. Okay. Essential component is hand hygiene. Pag sinabi po natin sa essential component ng hand hygiene, especially the important after the contact with the patient and the contaminated equipment of other surfaces. Okay, hand hygiene before you enter the room, and then after you enter the room, and then before you touch the patient, and then after you touch the patient, and then by using collecting all the specimen or contaminated fluid from the patient. Supposedly you should hand hygiene is the most important. After and before you should you should do hand hygiene. Okay. Next is the staff equipment and surfaces. Make it sure na keep clean. Ngayon, kailangan maging malinis lagi. Linisin, then handling patient equipment with care. And then ensure all the reusable equipment is repros, and then the linen handle, transport, and proper with care. Yan, pag-handle ng linen, pagkakatapos gamitin ng pasyente, then pagka-transport, make it sure na naka-tie yun, pag kinuha natin sa linen bag. Sa linen bag, lagay natin yung mga dirty, lagay natin, and then after, yung matransport ang process, paano po itatransfer yun or itaprocess with care. Kailangan po transport with the proper care. And then, next one, the essential components too. Ano po yung mga essential component too? Number one is personal protective equipment. Ano po ba yung mga personal protective equipment? Number one is gloves. Ang gloves, change between the patient. Yun, kinakailangan po lagi natin na magpapalit po ng gloves. Hindi po yung isang glove para sa lahat ng pasyente na contaminated na po ang pasyente. Hindi na po pasyente, pati po kayo contaminated na. Kasi kung gagamitin niyo po yung gloves na ginamit nyo sa ibang pasyente, tapos gagamitin nyo sa ibang pasyente, contaminated na po yung gloves na yun. Then remove immediately after use. Pagkatapos po natin gamitin, kinakailangan po natin ma-remove natin immediately. Hindi po yung nagamit na natin tapos kung saan-saan pa tayo hawak. Then after you touch the patient, after you leave the patient room, make it sure remove immediately the gloves. and do not reuse. Yun nga po sinasabi ko kanina, kinakailangan po na hindi siya nire-reuse. Kasi po, ang gloves po ay hindi reusable. Yan po ay disposable. Next one is the clothes. Yung clothes, remove if soiled or wet as soon as possible. Kapag nakita niyo po yung damit ng pasyente na basa na or make it sure na make it sure na na yung clothes niya nare-remove, wet na kasi kinakailangan mapalitan na siya. Kasi contaminated na yun, lalo na kapag mga urine na nakakontaminate sa kanya naka-wet. And then the third one is the mask. Okay, the third one is mask, goggles, visor, and respirator. O kapag sinabi natin yan mga ganyan, yan yung mga ginagamit natin mga personal protective equipment. Yung mask, goggle, visor, and respirator. Okay, protect against blood, body fluid, and splashes. Disinfect as needed. Yan, kinakailangan natin yan. Yung mask, pinapalitan na natin yan. Pinapalitan na, pinatapon na yan kasi disposable din po yan. Next essential component number 3. Tayo, family members providing care of patient must be educated. Yan. Kinakailangan po talaga maging educated po yung family members ng pasyente. Kasi bakit po? Why is very important to make it sure that the member of the family is educated. Kasi nga po, at least alam nila yung precautionary measure na gagawin nila kapag ang pasyente nila ay communicable. And then number 2 is practice good hygiene. And the most important is you should know how to practice the hand hygiene. And then the third, next is use appropriate precautionary prevent spread of infection. Paggamit natin ng mga precautionary appropriate precautionary to prevent the spread of infection. The last one is precautionary for family members should be the same of those used by the staff. Okay. The third one, okay. Next, consideration about the isolation precaution. Ano po ba yung mga consideration about the isolation precaution? Number 1, in most cases, standard precaution are sufficient. Number 2, based on clinical signs and symptoms. And number 3, we will consider this under of this, kailangan natin i-consider to. Kasama to sa consideration about the isolation precaution. Una-una, based on the clinical signs and symptoms. Depende yan sa symptoms ng pasyente. And then, in most cases, standard precaution are sufficient. And then, number 3 is consider na po natin yung single room when gross contamination of the environment is likely. For example, is the wound, diarrhea, and the bleeding. Yan, single room. When gross contamination of the environment is likely the wound, diarrhea, and bleeding. The second one is door closed when the contact transfer is likely. Make it sure that the door of the patient room is already is closed because of the injured skin. And then the third one is ventilate the outside when airborne transfer is likely. One of the airborne po ang tuberculosis. Kaya po ang kinuha ng proper ventilation po. Hindi po yung ang mas maganda po kasi pag sabi natin proper ventilation, yung hangin sa loob ay nakakalabas, yung hangin sa loob ay nakakapasok. Para in and out po para po maganda po yung ventilation ng pasyente. And then use airlock when massive airborne transfer is likely. Like varicella. Yun nga po. Kinakailangan naka-airlock ng massive airborne. Ayun nga po yung tatawag natin na meron din pong mga kapag airborne na, madami din po ang ginagamitan yan kapag airborne. Next, general recommendation, dispose the feces, urine, and the secretion via designated sink and clean and disinfectant containers. Yan po. Kinakailangan po natin yung mga dumi, ihi, yung mga secretion na nanggaling sa pasyente, kinakailangan po natin din yung disinfect ang containers po para po at least matanggal po yung mga microorganism o yung mga bacteria. Next one is the clean up spill promptly. Yan. Clean up spill promptly. Pag sinabi natin na next one is to ensure the patient care equipment, supplies, and linen is clean and or disinfected between each use. Yun. Kinakailangan po din natin linisin talaga lahat po yun. One of the recommendation, the general recommendation. For example, also the tuberculosis patient developed a protocol. Kasi ang tuberculosis po ay airborne. Kinakailangan po natin yung proper cleaning. Next one. Yan. Tapos na po tayo sa isolation precaution. And then we're going to proceed in hand washing. Okay, pag sinabi po natin hand washing by using of soap and water. Okay, ang topic for today, the second topic for today is hand washing. Okay, pag sinabi natin hand washing, what is the objective of hand washing? By the end of this lesson, the topic will be able to, okay, number one, identify who should practice hand hygiene. And then number two, the second objective, describe what hand hygiene is. Number three objective, identify where hand hygiene practice should be take place. Objective number four, explain why hand hygiene is important. Objective number five, describe when the hand hygiene is to be performed. And the last objective is describe how to perform hand hygiene using the various steps. Okay. Introduction. Okay. Introduction for the hand washing. Hand washing is the single most effective way to prevent the spread of germs, microorganisms, which prevent communicable diseases. It's easy to learn how to wash your hand and how to stop the spread of infection by washing the germs away. Good hand washing can prevent diseases such as shigellosis, E. coli, yung tinatawag natin E. coli, streptococcal disease, influenza, and the common cold. And then we can pick up the germs from the doorknob, stair railings, or anything that has been touched by other person aren't good hand washer. Yun po, yung mga example po niyan, yung mga paano po natin makukuha po yung pag po pa tayo nag-hand washing kasi we can pick up the germs, makukuha po natin yung mga germs na yan by touching the doorknobs, stair railings, or anything that may be touched by the other person. Yung mga nagagamit po na hawakan ng ibang tao na pwede rin po natin hawakan. Next, the definition of hand washing. What is hand washing first? The definition of hand washing is hand washing or hand hygiene is the one of the cleaning one hand with or without the use of water or another liquid, or with the use of soap and the person removing soil, dirt, and or the microorganism. That is the definition of hand washing. Okay. Next, who should practice the hand hygiene? Who should practice the hand hygiene? Hand hygiene practicing is not important only for the healthcare providers. Everyone needs practicing appropriate effective hand hygiene to prevent spread microorganisms. Pagdating po sa hand hygiene at saka po yung hand sanitizing, hindi lang po mga health practitioner ang gumagawa niyan. Kinakailangan po lahat po ng tao, kinakailangan po ay marunong po kung paano ginagawa yung hand hygiene at hand sanitizing. Hindi lang po healthcare provider ang gumagawa niyo. Next, where should you perform the hand hygiene? Where should you perform the hand hygiene? Okay. Busy. Okay, number one, busy healthcare provider need access to hand hygiene protects where patient environment contact is taking place. Number two, hand hygiene is important in all work settings, include acute care, long-term care facilities, community, and corporate sites. Number three, providing alcohol-based hand rub at the point of care with arms reach is an important system support to improve hand hygiene. Okay, why should you perform hand hygiene? Yan po. And do you need to learn about hand hygiene? Bakit po kinakailangan natin malaman o matuto ng pag-hand hygiene? Number one, hand hygiene is the most important way to prevent to spread the germs. Para po maiwasan po natin yung pag-spread ng germs ay kinakailangan po natin yung hand hygiene. Number two, hand hygiene keeps you healthy by reducing the number of germs on your hands and help reduce the spread of germs to your family, friends, coworker, patient, residents, or clients. And the third one is using appropriate hand hygiene prevents contamination of the patient, clients, or the resident environment. Bakit po kayo napakahalaga yung hand washing? Kasi nga po, ang kamay natin kung saan-saan natin nahawakan, ito po yung lahat ng gagawin na hawakan natin. Then, kung saan-saan po natin nahawakan, kailangan po talaga natin yung hand hygiene. And next is when do you perform the hand hygiene? When do you perform? Kailan ba dapat natin gumagawa tayo ng pinag-perform natin yung hand hygiene? Number one, before initial patient or the patient environment contact, before aseptic, and then before initial patient or patient environment contact. Number two, before aseptic or clean procedure. Number three, after the body fluid exposure. Number four, after contact with patient or patient environment. Yan po yung kailan po natin kinakailangan ng pag-perform ng hand hygiene. Yan nga po yung sinasabi ko kanina na kinakailangan ng yung before and after na touching the patient. Yan po. Yung 5 moments of hand hygiene po yan. Yan po doon. Saan po mapasok yung 5 moments of hand hygiene. Next, how to perform the hand hygiene. Yan po. Tinatanong po dito kung paano daw po i-perform yung hand hygiene natin. Proper technique is important when it comes to effective hand hygiene. Without proper hand hygiene technique, we can still spread many microorganisms with our hand. This section will cover the proper techniques for the following procedure. Yan po yung how to perform the hand hygiene. Number one, wet the hands under the running water. Babasain po natin ng tubig ang ating kamay or babasain natin ang ating kamay gamit po ang tubig na nasa gripo. Pangalawa, apply soap and distribute over the hands. Yan po. Diba, kailangan po pagkakuha po natin ng soap, ma-distribute po natin sa buong kamay. Number 3, rub hands together vigorously for 15 seconds to create a good lather palm to palm. Number 4, rub the fingertips of each hand in an opposite palm. Number 5, between and around the fingers. Number 6, rub each thumb thrust or in an opposite hand. 7, rub back of each hand with the opposite palm. Number 8, rinse hand thoroughly under the running water. Yan po yung mga Yan po yung ah, proper hand washing. Ayan. Kung may question po kayo, pwede po kayo magtanong and slideshow. Thank you po. Ayan. Sa lahat po ng wala pa siyang ang pangalan niya. Siya sa mundo, lahat ng sino niya ay sinaputo. Naniniwala siyang champion sa anilo. Sa sobrang galit ng misis ko, bali-bali man ang tulo. Hasta la Pizares Idol.